Good day, Wonder Nurses. I'm Nurse Anne. Today, we will have a brief discussion about growth and development. I also prepared something for you to fill up, and then we will answer it together. This is to assess your knowledge about the topic. So if you're ready, let's start. Let's first define growth and development. Growth. It is the physical change. It is a quantitative change in size, which means it is measurable. The best indicator is the weight. Development. It is the increase in skill and ability to function. It is a qualitative change, which means it can be observed. Let's now proceed to the principles of growth and development. First, growth and development are a continuous process that starts from conception until death. Number 2, it has a sequence or with the same pattern but with different rates. It follows a sequence, meaning growth starts from smaller to higher, and the development of skills starts from gross to refined skills. Regarding the rates, some body tissues mature more rapidly than the other. Number 3, cephalocaudal and proximal to distal development. An example for a cephalocaudal development is a child's head develops much sooner than his or her legs, while proximodistal means from near to far, referring to the center of the body to the extremities. An example of this is the early development of muscular control of the trunk and arms, followed by the hands and fingers. And lastly, there is a best time for the initiation of certain skills, from simple to complex tasks. In case you forget this, let us refresh your knowledge about the age bracket of each developmental stage. For the neonate, it is the first 28 days of life or the first 4 weeks of life. For the infant, we have 1 month to 1 year. Toddler, 1 to 3 years old. Preschooler, 3 to 5 years old. School age, 6 to 12 years old. An adolescent is 13 to 21 years old. Before we proceed to our mini pre-test, please don't forget to subscribe to our channel and click the notification bell to keep you updated to our latest video. I really appreciate the support. Let's continue. Try to fill this up before we proceed to Sigmund Freud and Erikson's stages of development. You have 1 minute to answer. Okay, let's fill up the blank spaces. For infants, they have stranger anxiety and they prefer solitary or to play alone. We can just give them a rattle toy. For toddlers, They have separation anxiety and they love parallel play, like the push and pull toys. Preschoolers are afraid of mutilation and castration. During this stage, they are imaginative in nature and they love to try role plays and to dress ups. For school age children, they are afraid of being separated from school. Since they develop friends in school, the answer here is cooperative play. Finally, adolescents. Their fear is displacement from peers, and they prefer to play sports or being athletic. Let's proceed with the next one. If you are aware of Sigmund Freud's psychosexual stages, this will be an easy one to fill up. You have 1 minute to answer. Okay, let's now discuss Sigmund Freud's psychosexual stages. Infants. This is the oral stage. The infant explores everything using his or her mouth. Therefore, provide safe and clean toys. Feed also according to infant's need. Toddler. It is the anal stage. The toddler starts toilet training. Preschooler. We have phallic stage. They learn sexual identity through awareness of the genital area. Latent stage for our school age. Child's energy is focused in developing skills and acquiring knowledge. Finally, adolescent. We have genital stage. They develop sexual maturity and establish relationships with the opposite sex. Our last topic is Erikson's psychosocial development. Time to use your stock knowledge. 1 minute starts now. Okay, time's up. Let's now discuss Erikson's psychosocial development. Infant. Trust versus mistrust. To develop the child's sense of trust, they must receive consistent care from the primary caregiver, which is the mother. Toddler. Autonomy versus shame and doubt. If a toddler is encouraged and supported during this stage, they become more confident and secure in their own ability to survive. But if they are criticized and controlled, they may feel inadequate and doubt their own abilities. Preschooler. Initiative versus guilt. During this stage, children interact frequently with their friends in the school. They begin to plan and initiate their games or activities. If this opportunity is given, children may develop a sense of initiative and able to make decisions. School age. Industry versus inferiority. Let the child develop and learn how to do things well. If children are encouraged and reinforced, they begin to feel industrious and confident in their ability. Finally, adolescent. Identity versus role confusion. Adolescents start to learn who they are and learn the roles they will become as an adult. Success in this stage will lead to the virtue of fidelity.
Thank you for listening. I hope you learn and understand something. If you want more videos, don't forget to subscribe. See you on the next video.